The jaw you have right now, the one holding your teeth in place, the one shaping the lower third of your face, is not the jaw you had 10 years ago. It is measurably smaller. And here's the part that should concern you. It will be smaller still in 5 years. After the age of 40, mandibular bone density decreases at a rate of roughly 1 to 2% per decade. And in women after menopause, that rate accelerates. The bone doesn't announce its departure. There is no pain signal, no warning label. Your face simply reshapes itself around the loss, and you adjust to the mirror without realizing what moved. This is not speculation. The skeletal record is clear, the anthropometric data is consistent, and the mechanism is well understood. But the window for doing something about it narrows with each passing year, because bone responds to stimulus on a timeline measured in months. And the stimulus most of us provide is nowhere close to what the jaw requires. Every year you wait is a year the bone had no reason to maintain itself. To understand why your jaw is shrinking, you have to understand what built it in the first place. And that means going back, not decades, but millennia. For roughly 200,000 years, the human jaw was one of the most mechanically loaded bones in the body. Paleolithic humans chewed for 2 to 4 hours every day. Raw tubers, dried meat, fibrous roots, and unprocessed grains. The food was tough, resistant, and it demanded sustained muscular effort from the masseter, the temporalis, and the medial pterygoid muscles. Those forces transmitted directly into the mandible and the maxilla, and the bone responded the way bone always responds to mechanical loading. It grew dense, it grew wide, and it maintained its volume across the entire lifespan. Daniel Lieberman at Harvard has spent decades studying craniofacial evolution, and his work on Paleolithic and early Holocene skulls reveals something striking. These skulls have wide dental arches, full eruption of all 32 teeth, including wisdom teeth, with room to spare. Virtually zero malocclusion. The teeth are worn from use, sometimes worn flat, but they are straight, evenly spaced, and fully supported by robust bone. The jaw wasn't just adequate, it was overbuilt for its task, because the mechanical demands were relentless, and the bone adapted accordingly. This is not a genetic superiority argument. The genes that built those jaws are the same genes sitting in your cells right now. The difference is not in the blueprint. The difference, and this is the part the standard narrative misses, is in the environment that activates the blueprint. The jaw is not a fixed structure determined at birth. It is a dynamic organ that remodels continuously in response to the forces applied to it. Remove those forces, and the bone has no reason to maintain its architecture. It doesn't decay, it economizes. 10,000 years ago, everything changed. The agricultural revolution introduced grain processing, cooking, and food storage. Porridges replaced raw tubers. Ground flour replaced whole grains. The caloric efficiency went up. The chewing demand went down. And the jaw, over generations, responded precisely as Wolff's law predicts. Julius Wolff published his observations in Berlin in 1892. The principle is straightforward. Bone remodels along the lines of mechanical stress. Load a bone and it strengthens. Unload it and it resorbs. This is the same principle that causes astronauts to lose bone mass in microgravity, and the same principle that makes weight-bearing exercise protective against osteoporosis. There is nothing controversial about it. Every orthopedic surgeon, every sports medicine physician, every physical therapist operates within its framework daily. Yet somehow, when the conversation turns to the jaw, this principle gets ignored. The shrinking mandible gets filed under aging or genetics, and the mechanical explanation, the one that actually fits the evidence, gets overlooked. Robert Corricini at Southern Illinois University spent years documenting what he called the discordance hypothesis. He compared jaw development in populations eating traditional diets with populations eating processed diets, sometimes within the same ethnic group separated by a single generation. The results were consistent. The population eating processed food had narrower dental arches, more crowded teeth, higher rates of impaction, and smaller mandibular dimensions. Same genes, different mechanical environment, different jaws. This was not a slow evolutionary drift. This was an environmental response visible within one generation. A parent who chewed tough food had a wider jaw than their child who ate processed food. The genes didn't change. The activation stimulus changed. The bone simply expressed what the environment demanded, and the modern environment demands almost nothing. The second collapse came with industrial milling. In the 1800s, steel roller mills replaced stone grinding. Flour became finer than at any point in human history. Bread became soft. Canned food arrived in the early 1900s. Processed baby food appeared in the 1930s and 40s, removing masticatory effort from the earliest developmental window, precisely when the jaw's growth plates are most responsive to mechanical input. Each generation inherited the same genetic potential and received less stimulus to express it. Weston Price, a dentist who traveled the world in the 1930s, documenting facial structure across cultures, observed something that the dental profession has never fully reckoned with. Populations that maintained traditional diets, foods requiring vigorous, sustained chewing, had broad faces, wide arches, and straight teeth. Populations that had recently adopted processed Western diets, sometimes within a single generation of transition, showed narrowed arches, crowded teeth, and altered facial proportions. His methodology had limitations, and his conclusions sometimes overreached. But the photographic and dental cast evidence he compiled remains difficult to dismiss. The faces changed when the food changed, period. So here's where we stand today. The average modern adult chews for roughly 30 to 40 minutes per day, mostly on food that offers minimal resistance. Compare that to the 2 to 4 hours of forceful chewing that characterized human life for the vast majority of our existence as a species. The mandible is receiving perhaps 15 to 20% of the mechanical stimulus it evolved to require. And the bone is responding accordingly. It is shrinking. The consequences extend far beyond dental crowding. The mandible is not an isolated structure. It is the floor of your oral cavity and the anterior wall of your airway. When the jaw recedes, the tongue loses space. A tongue that cannot rest comfortably in a smaller oral cavity drops backward toward the pharynx. The airway narrows. Nasal breathing becomes harder. The face, deprived of the forward growth stimulus that a properly developed jaw provides, remodels around the deficiency. Cheekbones sit lower. The midface flattens. The profile changes in ways that get attributed to aging, but are, in significant part, attributable to mechanical deprivation. The clinical evidence is plain. Sleep-disordered breathing, including obstructive sleep apnea, correlates strongly with mandibular retrognathia, a jaw that sits too far back relative to the skull. The prevalence of sleep apnea has increased in parallel with the dietary softening of the last century. Orthodontic intervention rates have climbed from under 5% of children in the 1960s to over 50% today in many Western countries. Wisdom tooth extraction has become so routine that many people assume the teeth themselves are vestigial. They are not vestigial. They are perfectly functional teeth in a jaw that no longer has room for them because the jaw was never loaded enough to grow to its full dimensions. Someone notices it first in photographs. A holiday picture from 12 years ago shows a face they barely recognize. Not younger exactly, but wider, more defined, structured differently. They compare it to a recent photo and something is shifted. The jawline has softened. The chin appears to have moved backward. The lower face looks compressed. They assume it is weight or aging or the camera angle. It is none of those things. It is bone. Someone else visits a dentist for routine crowding in their late 40s. The dentist recommends extracting 2 premolars to make room. This person pulls out their childhood dental records and finds that at age 12, their arch was wider and their teeth were straighter. The crowding developed in adulthood. The teeth didn't grow larger. The jaw grew smaller around them. A third person notices somewhere in their mid-50s that they cannot breathe through their nose as easily as they once could. No infection, no polyps, no structural obstruction visible on imaging. The airway has simply narrowed, incrementally, over decades. Their physician offers a CPAP machine. Nobody asks about the jaw. These 3 experiences are not rare. They are so common, they have become invisible, absorbed into the background noise of what we expect from aging. But aging does not explain why Paleolithic humans in their 50s and 60s had wider jaws, fuller dental arches, and more patent airways than modern 40-year-olds. Something else is operating here. Something mechanical, something reversible, at least in part. The protocol depends on where you are in life, because the jaw responds differently at different ages, and the risks vary with dental history and joint condition. If you are between 40 and 55, and your jaw joints are healthy, the most direct intervention is reintroducing mechanical loading through dietary texture and targeted exercises. Start with food. Replace soft bread with dense sourdough or hard crusts. Chew raw carrots, celery, and nuts deliberately, not as snacks swallowed quickly, but as chewing exercises, sustained for 2 to 3 minutes per session. Tough dried meat, if your diet permits it, provides excellent sustained resistance. The target is to increase daily chewing time from 30 minutes to 60 to 90 minutes, spread across meals and dedicated chewing sessions. Mastic gum, the tree resin used for centuries in Mediterranean cultures, provides controlled, sustained resistance. Chew it for 10 to 15 minutes twice daily on alternating sides. Beyond diet, myofunctional exercises strengthen the muscles that load the jaw. Tongue posture is the foundation. The entire tongue resting on the roof of the mouth, not just the tip, with lips sealed and teeth in gentle contact. This position loads the maxilla from below and the mandible from the muscular sling above. Hold it as your resting default. It will feel unnatural for 2 weeks, then it will feel normal. If you are between 55 and 70, the approach requires more caution. Dental restorations, bridges, implants, and any history of temporomandibular joint dysfunction change the loading equation. Aggressive chewing on a jaw with significant dental work can damage restorations or inflame a compromised joint. Start with tongue posture, the same roof of mouth resting position, and nasal breathing as your primary interventions. These are zero risk and provide sustained, gentle mechanical stimulus to the maxillary and mandibular complex. Add gentle chewing resistance gradually. Softer gum rather than mastic resin. Longer chewing of regular food rather than introducing maximally tough textures. If you wear dentures, the protocol shifts further toward tongue posture and soft tissue exercises because the mechanical transmission to bone through dentures is less efficient. A myofunctional therapist, specifically one trained in orofacial myology, can design a program calibrated to your dental and joint status. These practitioners exist, they are licensed, and the field has grown substantially in the last decade. If you are over 70, the goal shifts from reversal to preservation. Bone remodeling still occurs at every age. The rate is slower, but the principle is unchanged. Sustained, gentle chewing, nasal breathing, and tongue posture maintenance continue to provide stimulus. The objective here is not to rebuild what was lost over decades, but to slow the continued loss and maintain airway patency. Even modest mechanical input, chewing food thoroughly instead of swallowing quickly, maintaining tongue posture during rest, breathing through the nose rather than the mouth during sleep, signals the bone to hold rather than release. Across all age groups, one intervention deserves specific emphasis: close your mouth. Mouth breathing, especially during sleep, deprives the oral cavity of the mechanical equilibrium that nasal breathing provides. The tongue drops away from the palate. The cheeks exert unopposed inward pressure. The arch narrows from lack of outward tongue force. Taping the mouth during sleep, using surgical tape designed for skin, is a practice that has gained clinical support from sleep medicine physicians, including those at Stanford's Sleep Medicine Center. It is simple, inexpensive, and for many people, it is the single highest impact change available. 2 paths from this point forward. In one, you finish this video, note that it was interesting, and continue living in the same mechanical environment that has been shrinking your jaw since childhood. The bone continues its quiet departure. The face continues its slow restructuring. The airway narrows by another fraction of a millimeter this year, and another the year after that. In 5 years, the jaw you have today will be a jaw you had. In the other path, you change the mechanical equation this week. You chew harder food longer. You rest your tongue on the roof of your mouth. You close your mouth when you sleep. The bone registers the new loading environment, and over months, the remodeling equation shifts from net loss toward equilibrium, and in some cases, toward modest net gain. The difference between these two paths is not dramatic. It is not overnight. It is cumulative, and it is real. And the evidence from every population that has ever transitioned between high resistance and low resistance diets confirms it. The window I mentioned at the beginning, the biological window that narrows each year, is still open for you today. And I am grateful that you chose to spend the last 30 minutes understanding what is happening inside a bone that most people never think about. Because that understanding is the difference between watching a slow process you cannot name and intervening in a mechanical equation you now fully comprehend.